Good morning. I'm going to present the findings of a validation study that we have conducted. Validation of Sinhalese version of Cornell Scale to assess depressive symptoms in the demented population in the Sri Lankan context. Depression is a frequently accompanying comorbidity in dementia which contributes for increased morbidity, mortality and poor quality of life. Diagnosing of depression is also challenged by many reasons. Unfortunately, the utility of most of the rating scales are also limited in this regard due to difficulty in administration to cognitively impaired elderly people. Cornell Scale, which is currently known as the gold standard to assess depressive symptoms in the demented population, is a 19-item structured interview which assesses depressive symptoms over 5 domains: mood, behavioral and physical symptoms and signs, cyclical functions and ideational disturbances such as depressive cognitions and delusions. The most remarkable feature is that it uses a comprehensive interviewing technique to elicit information not only from the patient but also from a caregiver. So our main objectives were to translate the Cornell scale in a culturally adapted manner to Sinhalese language and to investigate its validity and reliability. I will briefly define the concepts of validity and reliability here. Validity is the degree to which an instrument measures what it intends to measure. In other words, it's an estimate of the accuracy of a test. Reliability is the ability of a scale to convey reproducible and consistent results across different circumstances. In other words, it's an estimate of the repeatability of a test. The initial task was to translate the Cornell scale in a culturally adapted manner, which was conducted by a panel of 5 experts in the field consisting of consultant psychiatrists and senior registrars using a stepwise forward and backward translation method known as the Delphi method. As an initial step, individual independent translations were conducted by each panel member. Later, the panel assembled, translations were rated and consensus was achieved, generating the version 1 of the Cornell scale. It was back translated into English by 2 bilingual experts, leading to the backward translation. It was compared with the original Cornell scale to detect any misunderstandings, mistranslations or inaccuracies. Few minor modifications were done, generating the version 2, which was pre-tested on 10 patients and assessed for feasibility in administration, comprehension and clarity. Few minor modifications were done again, generating the final Sinhalese version of the Cornell scale or the CSDD-S. Our main objective was to determine the validity of the CSDD-S. There are different measures of validity. Face validity is the extent to which the scale is subjectively viewed as a suitable measure of depression in patients with dementia. Content validity is the extent to which each item represents all facets of depression. Semantic validity is the extent to which the terminology in the original document is compatible with the translated version. A panel of experts who were not involved in the translation process went through the scale and gave their approval with regard to these 3 types of validity. Criterion validity is a more accurate measure of validity. It is the extent to which the results yielded by a study are correlated with the gold standard. For our purpose, clinical diagnosis of depression by a clinician using ICD criteria was considered as the gold standard. Concurrent validity is another type of validity. It denotes the degree to which the test findings correlate with other existing measures of the same construct or other scales, in other words. It was assessed against the Sinhalese validated version of geriatric depression scale, which is currently being widely used to assess depressive symptoms in elderly population. To determine the validity, we conducted a descriptive observational study. Both in and out patients were incorporated from NIMH, NHSL and a residential care place. People with mild to moderate dementia who are able to communicate in Sinhalese language were incorporated, while demented, severely demented, delirious and people who are unable to communicate in Sinhalese were excluded. Sample size was calculated as 108 using this formula. Prevalence was taken as 32% according to a recent study. Duration was 18 months. These are the study tools used. MMSE to determine the level of cognitive impairment, a brief questionnaire to obtain some socio-demographic data which are relevant, and the Cornell scale was administered in 2 steps. Initially to an informant either to a nursing officer, a residential care worker, or a family member, depending on the setting, followed by interviewing and observing the patient, generating the final Cornell score. Geriatric depression scale Sinhalese version was also administered to the same population. Clinical assessment for depression was done by a consultant or a SR to determine depressive symptoms. The tool administrators and the clinicians were blinded. These are the results. This is how the 108 sample was scattered across different settings. Majority were the inpatients from NIMH, but there were outpatients as well. The mean age was around 70 years. Roughly equal numbers of males and females represented the sample. This histogram represents the age and gender distribution of the sample. I will not go into details of the descriptive statistics, but what I wanted to highlight here is that the subgroup of the sample who were identified to have depressive symptoms according to ICD criteria by clinical assessment also had higher scores in the CSDD-S and the GDS, which was statistically significant. So our main task was to determine the validity. To determine criterion validity, receive operating characteristic analysis or ROC analysis was used. It is based on the statistical concept that the sensitivity of a test has an inverse correlation to specificity. So plotting sensitivity against 1 minus specificity known as ROC curve and calculating the area under the curve is considered as a valid method in evaluating the accuracy of a test. So these are the two ROC curves generated using the statistical packages, CSDD-S and for GDS. Each point here represents a particular cutoff value. The original scale had two cutoffs. Our aim was to yield a cutoff point with maximum sensitivity while preserving specificity. The analysis showed that a cutoff point above 7 appeared to provide the best balance between sensitivity and specificity. Area under the curve was calculated as 0.997, demonstrating excellent criterion validity. Concurrent validity was assessed using the Pearson correlation coefficient. It measures the strength of linear relationship between two variables. So our two variables were the CSDD-S and the GDS. A scatter plot was generated. The Pearson R value was 0.94, again reflecting excellent concurrent validity of CSDD-S in comparison to GDS. Reliability was determined in terms of internal consistency, which is the extent to which all items measure the same construct or the concept. Inter-item correlations is the degree to which scores on one item are related to the scores on another item. Internal consistency was assessed using Cronbach's alpha coefficient, which was 0.91, which reflected good internal consistency. The inter-item correlation value was 0.48, reflecting desirable inter-item correlation. So in conclusion, these indices demonstrate that CSDD-S is a valid, reliable and a sensitive tool. At a cutoff point above 7, it shows excellent accuracy, which justifies its use for screening, evaluation and monitoring. I have a hard copy of the translated version here. Since it cannot be displayed here, I can provide if I'm allowed. There were a few limitations. The sample might not represent the whole Sri Lankan population, and as most of the participants were from Colombo area, there was a vast heterogeneity among study settings. Patients with severe dementia were excluded, and recall bias of informants when giving information might have affected the study scores. Thank you very much.